committees. And on behalf of the State Senate Committee, if the chair would please call the roll. Or secretary, I'm sorry.
Senator Deneen. Here. Senator Funky Fromeyer. Senator Girdler. Senator Herron. Senator Meredith. Senator Mills. Senator Webb. Senator Williams. Senator Wise. Senator Mays Bledsoe. Chairman Carroll.
Here, we do have a quorum and are duly authorized to conduct business.
Good morning. I hereby call this the 5th meeting of the House Standing Committee on Families and Children to order. As a reminder, please silence your cell phones. Do any members have any guests they would like to introduce before we call roll? Representative Kleins?
And thank you, Madam Chair. I'd like to introduce my page for today, Logan. He's the 7th grader at Highlands Middle School. Welcome, Logan.
Thank you very much.
Welcome to the circus, Logan. You picked the craziest day to be here this session. DJ, please call the roll.
Representative Bojanowski.
Here.
Representative Callaway.
Present.
Representative Kleins.
Yes.
Representative Dietz.
Here.
Representative Doan. Representative Duvall.
Here.
Representative Elliott. Representative Holloway.
Here.
Representative Mosier. Representative Pollock.
Here.
Representative Rayburn. Representative Riley. Representative Rorks.
Here.
Representative Stalker.
Present.
Vice Chair Wilson. Chair Heverin.
Here. Okay, it looks like we are duly constituted to do business as we have a quorum in the House.
Okay, the only item of business on the agenda today is the legislative hearing on the 2025 Social Services Block Grant preliminary plan. Commissioner Dennis, if you will, please approach the table, and Ms. Carpenter, please introduce yourselves for the record, and you have the floor.
Good morning, and thank you for the opportunity to be here today. My name is Lisa Dennis, and I am the Commissioner for the Department for Community-Based Services.
Good morning. I'm Mary Carpenter. I'm an executive advisor with the department.
So again, thank you. Thank you for the opportunity to be here today. Here on this slide, we have a quick overview of the department. The Department for Community-Based Services is dedicated to strengthening families, enhancing self-sufficiency, and ensuring safety and permanency for children and vulnerable adults. Through collaborative decision-making with families and community partners, the department provides critical services, including child care, child and adult maltreatment prevention and protection, caregiver support, and public assistance. We have approximately 5,000 employees, and with at least one office in every county. And you see our map there with our 9 service regions and how those are broken up. The Social Services Block Grant was established by Congress through the Omnibus Budget Reconciliation Act of 1981 to support essential social services, and it has 5 key goals: promoting economic self-support and self-sufficiency to prevent dependency, preventing and addressing neglect, abuse, or exploitation while preserving and reunifying families, reducing institutional care by expanding community and home-based care options, and ensuring institutional care access when necessary and providing services for those in institutions. The department administers the Social Services Block Grant, which requires an annual state plan to meet federal requirements and secure funding for statewide services. States have the authority to determine services, eligibility criteria, and delivery methods to align with program goals. And you see here on the slide those programs that is supported by the grant in Kentucky, which is Adult Protective Services, Child Protective Services, Home Safety Services, Juvenile Services, Residential Treatment Services, and Staff Training. To be eligible for these services, you must be a Kentucky resident or juvenile classified as a runaway, and services are based on individual or family needs and resource availability. The following items the department uses to create our annual goals for the Social Services Block Grant. We use programs, the required programs required to be administered by statute, prior and present service utilization, funds available. We use information obtained from surveys, focus groups, program evaluation and monitoring, and the availability of funds and historical data trends. Funds provide for staff or services contracts with individuals, other public agencies, or private providers to provide direct services, and state mandated programs are prioritized. And here on this screen, you see the funding for the Social Service Block Grant. The federal portion of that is approximately $21 million annually, and the majority of that funding is spent again on staff and staff training.
So just a little bit more detail about the how we're using these funding. The funding, Commissioner mentioned Adult Protective Services. So we, our APS staff are investigating abuse, neglect, and exploitation as required under statute. So that looks like actually going out, doing those investigations, locating and obtaining resources, and assisting and securing placement with caregivers in facilities, or potentially just with caregivers. Also, as she mentioned, using data. So this is a look at some of our data for state fiscal year 21 through state fiscal year 24. This is actually unique individuals. So with Adult Protective Services, that is vulnerable adults. So this is a look at the abuse, caretaker neglect, self-neglect, and exploitation for those individuals. So when you're working with vulnerable adults, they do have the right to self-determination. So when you look at the self-neglect, that has been actually trending down for the last couple of years. So we have had access to some federal funds over the last couple of years that we've been able to access and provide goods and services to those vulnerable adults. So we think that that's why this data has been trending down for the last couple of years, being able to provide them with resources that we haven't necessarily had access to prior to 2022. Next slide. So for Child Protective Services, our frontline staff are conducting assessments related to child abuse, neglect, and dependency, making referrals for necessary resources and services. If individuals or if children cannot stay in their home safely with services in those homes, we may initiate court action, and referrals for appropriate treatment and placement may be necessary. Next slide. Again, looking at the data for the last couple of state fiscal years. So you can see here starting at all intake. So this is for all the calls that we receive into the department. So you can see we receive over 130,000 calls that actually come into the department. That's all calls that come in excluding APS. From there, all CPS response intake. So that is if a response is required. So we often get court orders from judges, so that could require a response, but it may not necessarily have allegations of abuse or neglect. So that's all CPS response intake. So you can see from there it goes down a little bit to the 99,000 for state fiscal year 2024. From there, intakes with allegations of child abuse and neglect, it goes down again slightly. So those are where allegations of child abuse and neglect are in those calls. And then you can see the decline where the allegations actually meet acceptance criteria. So those are where the calls do meet criteria under the statute, and we are actually going out to do an assessment or investigate and those are around 48,000. And then the substantiated or services needed finding are around 10,000. And then actual substantiated finding is 8,000. So there's a little bit of a difference between the services needed and then the substantiated finding there. Next slide. And these are the types of maltreatment that we're seeing. So the highest that you see there is the supervision neglect, around 25.3%. And then you can see the 31.2%, that's actual physical abuse. So we see the neglect together, it's a little over 50%. So we really have been working over the last couple of years to work with the community on differentiating between poverty versus neglect. So having that higher percentage around physical abuse, we really want to reserve our child protective services for those more serious types of interventions. So seeing that is what we have expected as we worked with the legislature to differentiate between poverty versus neglect and seeing those types of trends. Next slide. So home safety services, this really looks like providing meal prep, transporting children to visits, transporting children to appointments, and supervising visits for children that are in out-of-home care. And then next slide. Juvenile services, this is providing services for children that might be in the community, providing, coordinating treatment for youth who may be involved with the court system, children involved with juvenile justice, and providing treatment for those children, coordinating treatment for those children. Similarly, with residential treatment services, making referral for treatment, referrals for placement, coordinating those services for children who may be in need of treatment in a residential type setting. And then finally, staff training. So this is statewide training for staff. So this is our foundations training, and then we have ongoing training for our protection and permanency staff as well. This will look different next year. We're actually in the process of transitioning to a different training, but we're transitioning to a different structure. So this will look a little bit different, but we're doing that with Eastern Kentucky University at this time. And that's it. Any questions?
Representative Bojanowski.
Yes, if I may ask a question. So in light of our current federal administration and Elon Musk in part taking a chainsaw to government programs, how at risk do you see the $21 million that we get from the federal government?
We have not heard or seen anything at this point in time that about this funding, and that if it will be impacted.
If I may ask one more
Sure.
question.
Yes.
Yes.
Thanks. Okay. Can you explain what self-neglect is?
Yeah, self-neglect. It is when so Adult Protective Services supports adults who are vulnerable as defined by age and or physical or mental disability or delays. So if we get allegations that an individual is unable to meet their own needs and they're not safe, that would be a report of self-neglect. And we would go out and investigate and try and link those individuals with services within the community, make a determination whether they are able to make informed decisions on their own. And like I said, we try to connect them with services and supports when we can. But again, they have the right to self-determination, and if they do not want our services or interventions, they can decline. You're welcome.
Senator Herron.
Thank you, Mr. Chair. I do have a question, and thank you all for your presentation. Do you all have the number as far as the 21 million? How much of that money is actually going to juvenile services?
The federal piece of that that goes to juvenile services is around 30%, so around a little over $6 million.
Just one follow-up. Thank you for that, and I definitely would like to talk to you all more about what are the potential needs moving forward for that population. We know that we've had a lot of issues with our juvenile detention or a Department of Juvenile Justice in general, and so I want to make sure that whatever happens moving forward, that population does keep the funding, the potential funding that it needs. For one, to make sure that our community is safe, but also kids and staff are getting the things that they need to ensure that our young people are rehabilitating. And then just for this committee, I hope that in the interim that we as a body can work together to come up with the plan in case there are going to be cuts to these services. These are services that we need throughout the Commonwealth. And so again, thank you all for your presentation.
Thank you.
I have a question, and either one of you feel free to answer. When we talk about poverty versus neglect, and Commissioner, you hear all the cases that I do on the child fatality and near fatality review panel, and with depending on who enters that home, which agency they're with the same case, one can look at the situation in the home, the condition of the home as neglect, and the next person not. Can you talk a little bit about the data and how using maybe removing poverty in many times as being considered neglect, what impact has that had on our rates, instances of neglect? And do you all feel like the definition of poverty is clear enough so there is a consistency within those out in the field determining whether or not the condition of that home and the situation of that child's living conditions is poverty or neglect?
Well, I'll start, and Mary can chime in. We have been working with our staff as well as our partners across the state to really talk about what that looks like. What is poverty and what is neglect, and how those things intersect. Oftentimes we get allegations of neglect, and it is related to having adequate funds necessary to provide care for a child or family, and you may see a child that may come to school with clothing that maybe is considered not necessarily clean or poor quality of clothing, and that's normally related to poverty. And so connecting that family with resources and supports and addressing those immediate needs oftentimes enables us to see that family can safely remain together, and we look at that differently. So I think, as far as there's still opportunity to work with our community partners and even our own staff around those definitions and how to make sure there is a consistent understanding. But we have been doing a lot of work in that space the last couple of years, and again with the support of the General Assembly and as well as our partners in making that distinction.
I don't know that I can add anything more. I think that just the change that with like Senate Bill A, and that was a good first step, and there may still be more work to do there, but I think with the work that we're doing in the community, we have more opportunities with our staff and with community, and we're doing that, but there's still a lot more work to do, and we're making good progress. We just need to continue in that work.
So we are tracking the numbers of those allegations as it relates to the total DNA cases. So we know what impact removing those that category with poverty, what impact that has on our totals each year. Yes, no?
We've started doing more work at looking at the referrals that do not meet criteria and what's
Specific to poverty?
Yeah, yes.
Okay.
So, and just in the last year, so I think as we go forward that we'll be able to look more at that because we're looking at community pathways and how the community responds. So I do think we're going to have more, as we go forward, we're going to be able to really use our data to inform the work that we're doing.
And remind me, nationwide, is that, I mean, I know this was something that probably spiked our numbers. Nationwide, is that separated also so we're consistent when we look at data across the country?
Well, I would say we're a little bit ahead of what is happening nationwide, but I don't know that that's really happening nationwide.
Right, and we all know that neglect is the most common finding nationwide. But like Mary said, our work with the support again of our legislative partners and community partners Kentucky is standing out and leading some of that work nationally. And we're doing a lot of work with community. We are working to connect those families with community resources in different ways than what we have in the past, like creating different pathways. So if a referral doesn't meet criteria, that we can link that family to services within the community and let the community provide support to those families because the services, are oftentimes families are more likely to receive services from or hear talk to a community partner who they know and trust before they are with the agency. So really building out that community support piece and those pathways and looking at how we can ensure that the linkage when we see the need, even if it doesn't meet our definition of abuse or neglect.
Senator Webb.
Thank you, Mr. Chairman. And, where we live, Representative Moser and I were talking, the Friskies,
Yes.
if your kid's in public school, takes their boots on the ground too that assist with this. But my comment goes back to the chairman's question about the poverty and DNA. So as a practitioner, I think you all do need some clarification work. And the most compelling case that always haunts me as a rural practitioner is a case I had where the mother didn't have running water and she hauled water every day from the spring. I've got people in my community that haul water that can't get it or have a spring. And that was, stuck with me. It stuck with me for years. And I think you have an urban and rural definition of poverty. It's cultural. My grandfather, we never had running water. We had a spring. We didn't have indoor plumbing. We had an outhouse, but everything was legal, compliant, and all those things. And I've got a population that lives the same way. So I think when you look at that definition, and there are cultural in Kentucky, we have a very diverse population, urban and rural. So I think we need to be mindful of what actual poverty is, and I didn't think that as poverty growing up. I thought it was, it wasn't an issue to me. But when it was an issue to social services in southeastern Kentucky with a mother that was doing the best she could and providing potable water to her children, that has stuck with me. So I think as we move forward and we come up with those definitions, that we have to realize that there are differences and it's not a one-size-fits-all. So thank you, Mr. Chairman.
Representative Stalker.
Thank you, Chair. Two questions, and I think my first question might have already been addressed from the chairman. But if you could go back, Commissioner, to the slides where we were seeing the years. I want to better understand. Yeah, right there. So the difference between reports with a substantiated or services needed findings and then the reports with a substantiated findings, is that the difference that we're talking about as far as services that are just needed to differentiating the poverty component? Is that?
That's likely, yes.
Okay. What else might be the difference between those two?
So it could be reports that met acceptance criteria that are screened in, and then so thinking about the reports that also don't meet criteria. So thinking about opportunities to support those families. So we use this data when we're thinking about opportunities to provide support for families too. So thinking about those reports that screen out, and then also, to your point, the services needed. So it's both, I think. So we want those reports that don't screen in. We want to provide services to those families potentially if we can, because we know that when referrals screen out, a lot of times they come back to us. And so if we can provide services to those families and prevent referrals coming back to us, we want to do that. But then for those services, when they're needed, potentially those too, if there are those poverty related in there as well.
Thank you. And my follow-up question, if I may, please.
Yes.
Okay, thank you so much. It was already mentioned earlier about any concerns with, potential loss of federal funding. I'm pleased as punch to hear that you have not heard word of that as of today. My concern is that we have, it seems like every hour we're potentially bracing for what's the next thing to drop. So my question is to you all, to the best of your ability, what planning or just conversations have you had as far as if we lose any of that federal funding? Because I don't feel that we are in a position to lose that funding. And will you be prepared to come to the General Assembly and ask for funding should those federal dollars be lost? Because we clearly are not in a position to lose that and then still expect you all to perform the services that you are for the state of Kentucky. So if you could speak to anything on that.
Yes, we are monitoring daily, information that's coming from the federal government to see and to prepare. And you're right, we don't know at this point in time what may be impacted. So yes, we're monitoring that very closely, and we would need to come to the General Assembly with a budget ask if we were to lose any of our federal funding, because if not, there would be programs that would be cut.
Representative Mosher.
Thank you, Madam Chair. I have a comment and then a quick question, but this is a great conversation. I appreciate all of the work that you're doing. I do just want to comment that there have been a couple of points made about the potential loss in federal funding, and I just want to point out that in the first administration of this president, the focus was on the family first, with the Family First Act. And so I do think that there is a concerted effort to really understand what families need and how to best support them. So I'm not particularly concerned, but I do appreciate that we have a finite amount of money to work with, and we have a lot of families who need our support. I'm wondering if you are looking at, you mentioned that you are transitioning to a new training program, and I'm not exactly sure what that entails. Maybe you can fill us in, but there are some models that we have piloted here in Kentucky, MST, for example, the multi-systemic therapies. And I think that that's a great model that, you can, maybe you can talk to us a little bit about whether or not you're utilizing that, whether or not you're looking at those pilots, and how that's kind of forming your model of care, if it is. So.
Well, I'll let Mary talk about MST in just a second. We are partnering with some providers around MST, but back to the training piece, we are working to transition from. We've been administering our training through Eastern Kentucky University for a number of years, and we are looking to expand that opportunity with other universities and other partners throughout the state, to be able to have more opportunity for for more training opportunities to be statewide and more in person, and also more nimbleness, more resources available to quickly train our staff and give them the supports that they need. And we're looking to modernize again how we deliver training. So that work is underway right now, and we'll be making that transition this year. And like I said, we have appreciated our partnership with EKU, and they have been, and we again just looking at that and how to transition and be more nimble and more agile with our training opportunities. So they're working with us through that transition as we speak. And the MST piece, again, we do have some providers.
Yeah, we do have a pilot with MST. We have 3 providers right now. It's a partnership between DCBS and Medicaid. It is a pretty costly evidence-based practice, so we're evaluating that. We've been doing this for about 3 years now, so we extended the pilot for another 2 years. But it's if you know anything about MST, it's a very successul evidence-based practice. It sees the outcomes are really good. We're seeing those positive outcomes, so we would like to expand that. It's one of the evidence-based practices that's on our Title IV-E plan for Kentucky. So if we're able to expand it, I think we would like to do that. But right now it's in 3 areas of our state, so Jefferson, Northern Bluegrass, and then Central Kentucky. But we're seeing positive outcomes for that.
Wonderful. May I follow up, please?
Yes.
I'll make it quick. In terms of, and I love hearing all that because I think it is a great model. I know it's expensive, but maybe we can focus our efforts on those really high need areas, which is, I think, the intent of MST.
Yes.
Especially when it comes to our juvenile justice kiddos and their families. And when we were talking, we had a couple of years ago the Juvenile Justice Work Group, and we had a lot of great discussions about how to best reach our kids. And I think I'm sure I did, brought up MST at that point. Are you coordinating at all with DOC on the training of the folks who are working with our most at-risk kids in the juvenile justice system?
So at one point, I don't really want to speak for DJJ, but I'll speak that they had worked with MST, and then when they their contract ended, but I believe they're planning to come back on board with MST in the near future. So we have regular communication with them. They actually we use a program. It's called EQ2 around working with residential training. It's a model, and they're planning to bring them on, just to say that we work really closely on them on how we're supporting our children and youth, and so we share those models with them, and they have a lot of really good things coming up.
That's great to hear. Thank you.
Senator Funky Fromeyer.
Hi, thank you. When I look at the different responses, the intakes that you have to consider, we're recognizing that there's such an issue with sextortion and with human trafficking. And I think about that crossover of justice-involved children, and maybe they're battling symptoms to something pretty horrible. Do you have any sense for what sort of calls ultimately lead to involving the police to actually look into what is the actual root of these children's pain?
With regards to human trafficking, we have that data, and we partner with law enforcement on all those investigations, so we can get that for you.
In leading to your point about the changes in training, what is involved there? Is there further training now that we are recognizing more clearly that cell phones could be a tool towards creating significant self-pain?
Yeah, I think that's as we look at revamping our training, that's some of the changes we want to incorporate. But so yes, that is on our radar.
And we do have mandatory training for all of our staff around human trafficking.
Yes.
Okay, do we have any other questions from the Senate?
Any other questions from the House?
Okay, seeing none, I will entertain a motion to approve the 2025 social service grant from the Senate. From the Senate, sorry. Senator Funky Fromeyer, I have a motion second, Senator Webb. All those in favor, please signify by saying, I'm sorry. Okay, I'm sorry. Madam Secretary, please call the roll.
Senator Deneen. Senator Funky Fromeyer. Senator Girdler. Senator Herron. Senator Mays Bledsoe. Senator Meredith. Senator Mills. Senator Webb. Senator Williams. Senator Wise. Chairman Carroll.
Aye. Vote of 11-0, the motion carries. The Senate has approved the 2025 Social Services Block Grant.
All right. From the House, do I have a motion to approve the 2025? We've got a motion and a second. DJ, please call the roll.
Representative Bojanowski.
Yes.
Representative Callaway.
Aye.
Representative Klein's.
Representative Klein.
Yes. Yes.
Representative Dietz.
Yes.
Representative Doan. Representative Duval.
Yes.
Representative Elliott. Representative Holloway. Representative Mosier.
Yes.
Representative Pollock.
Aye.
Representative Rayburn. Representative Riley. Representative Rourke.
Yes.
Representative Stalker.
Yes.
Representative Wilson. Chair Heverin.
Yes. The plan is approved. As a reminder, the next meeting of the House Families and Children Committee will be today upon recess. Please listen for a message on the floor. The House is adjourned.
For the record, this was the 6th meeting of the Senate Standing Committee on Families and Children. We do not anticipate any other meetings this session. We stand adjourned.
Good job. Nothing to sign, so we're good to go.
Done.
Nothing to sign.
Okay.